Good day everyone. My name is Dr. Barclay Karnatki and welcome back to this YouTube channel. This is the fourth video wherein we will be talking about swellings. Now, what is the definition of a swelling per se? Swelling is nothing but an enlargement or a protuberance which can occur at any site within or on the human body. Now, there are many types of swellings, right? Cysts, abscesses, lipomas, etc. But in this video, we will be mainly focusing on two types of swellings. The first one being abscesses and the second one being lipomas. So without further ado, let us start with what is an abscess. An abscess is nothing but a collection of pus beneath the skin. Now this pus comprises of dead cells, leukocytes, as well as a few bacteria. Right? We will be discussing abscesses under three main subheadings, and three main subheadings correspond to the types of an abscess. The first one being a pyogenic abscess, the second one being a pyemic abscess, and the third one being a cold abscess. What is a pyogenic abscess, or the first subtype? Now, a pyogenic abscess, as the name suggests, is usually due to an infection, the infection primarily being staphylococcus. Now, this staphylococcus can gain entry either via an external wound or it can spread hematogenously within the human body. The result of this infection is production of pus, which is comprised of dead cells, leukocytes, and necrotic tissue. The surrounding collection of this abscess and pus is made of fibrin, and it's also called the pyogenic membrane. This membrane basically collects and keeps all of this pus localized to one small area and prevents its spread. Now, whenever we get an abscess, sometimes the only presenting symptom we can get with an abscess is, of course, one, noticing the abscess, and two, there being throbbing pain associated with the abscess. In rare cases, or sometimes, when it gets progressively bad, it can also be associated with a fever and with chills. This indicates that the bacteria has actually spread to the bloodstream. Now, signs. As a physician, what are the signs you will notice? Rubor, which is redness, dolor, and pallor, which is nothing but pain and an localized increase of temperature near the abscess. The treatment of an abscess. Sometimes some people, if they refrain from going to a doctor's, may let it burst spontaneously, where a small pus point may be formed and it will burst. However, if we visit a physician, the physician usually recommends an incision and drainage, where, as the name suggests, is pretty self-explanatory. A small stab incision is being made over the abscess, letting all of the pus drain, and then packing it with a gauze, to make sure there is no recurrence of this pyogenic abscess. Now, the second type of abscesses we will be talking about in this video is a pyemic abscess. Now, what is a pyemic abscess? A pyemic abscess is basically due to pus-producing organisms which is already present in the body. Now, it commonly occurs in people with chronic conditions like diabetics or people receiving chemo or radiotherapy. How would we differentiate a pyemic from a pyogenic abscess? Now, in comparison to a pyogenic abscess, they are deep-seated. Tenderness is usually minimal in pyemic abscesses, and there may or may not be a local rise of temperature. Many a times, there is no local rise of temperature. The treatment being the same, where multiple incisions are made and the abscess is drained. The third type is a cold abscess. Now, as the name suggests, why is it called a cold abscess? Because there may not be any symptoms or signs of inflammation or any rise of temperature, hence the name, and it is usually associated with tuberculosis. Now, after we've dealt with abscesses which are painful, which are incised, drained, have pus, we move on to a fairly benign swelling, this swelling being called a lipoma. As the name suggests, a lipoma is nothing but a collection of fat globules, and it is also called a universal tumor, as it can be present within any part of the human body. There are three main types of lipomas. The first one being a single encapsulated lipoma, which is nothing but a single soft glowing swelling. And on touching the swelling, usually there is a lobular-like feeling that one gets, not associated with any pain. That again helps you differentiate between an abscess and a lipoma. Fever also may be absent. The next type is multiple lipomatosis. Such lipomas are multiple and they are tender due to the involvement of nerve elements. So basically what happens is there are nerve elements interdispersed within all of the fat in the lipoma, therefore leading to tenderness on palpation. Now the last part is treatment of a lipoma. How do we actually treat these lipomas? Now, you know how we did an incision and drainage in an abscess? In a lipoma, we usually do an incision and dissection, where an incision is made over the swelling and it is dissected from the tissue, separating it, therefore preventing any recurrence, as that may be, one of the biggest worrying causative factors. A small lipoma can be removed by incising the skin and simply squeezing the lipid material out. Thank you for your time.